Why is a biopsy important for diagnosing bladder cancer? Have you ever wondered why a biopsy is such a crucial step in diagnosing bladder cancer? A biopsy is essential because it allows doctors to directly examine tissue samples from the bladder. This examination can confirm the presence of cancerous cells, which is something imaging tests or urine tests cannot definitively do. While those tests might suggest abnormalities, only a biopsy can confirm whether those areas contain cancer cells and help determine the type and grade of cancer. This information is vital for accurate diagnosis, staging, and treatment planning. Typically, bladder cancer diagnosis starts with symptoms like blood in the urine, pain during urination, or frequent urination. To confirm the diagnosis, doctors perform a procedure called cystoscopy. During this procedure, a thin camera is inserted through the urethra to visually inspect the bladder lining. If any abnormal areas are spotted, a biopsy can be taken at that time by removing small tissue samples from the bladder wall. The biopsy serves several important purposes. First, it confirms the presence of cancer. It helps distinguish cancerous tissue from benign conditions or inflammation, which can sometimes look similar on imaging or during cystoscopy. Second, it determines the type and grade of cancer. There are different types of bladder cancer, with urothelial carcinoma being the most common. The grade indicates how aggressive the cancer cells appear, which helps predict their behavior and guides treatment options. Another key aspect of a biopsy is assessing the depth of invasion. Even though biopsy samples are often small, they can provide insights into whether cancer has invaded deeper layers of the bladder wall. This information is crucial as it affects prognosis and treatment decisions. Treatment options can vary significantly based on cancer stage and grade. For instance, non-muscle invasive bladder cancer may be treated with bladder installations, while muscle-invasive disease often requires more aggressive therapies. Accurate biopsy results are essential for selecting the right therapy. Additionally, biopsies can be used to monitor recurrence. Bladder cancer has a high rate of recurrence, so biopsies might be repeated to evaluate any suspicious lesions during follow-up appointments. In summary, a biopsy is the gold standard for diagnosing bladder cancer because it provides direct evidence of cancer at the cellular level. This enables precise diagnosis and personalized treatment planning. While other diagnostic tools like imaging and urine cytology are helpful, a biopsy remains indispensable for confirming bladder cancer and guiding effective management. If you suspect bladder cancer, it is crucial to seek evaluation and biopsy from qualified urologists to ensure accurate diagnosis and optimal care.